I'm excited about kind of this, food is medicine, movement is medicine, both different movements, I would say. The food is medicine is interesting because everyone has to eat. Right now there are 1 in 8, closer now to 1 in 7 people are on GLP-1 in the US. There's going to be a lot of opportunity to shift behavior, and there is changes in how people basket is. I think if you engage in the right way, there's definitely places where gamification, nudging, and this type of health journey can also be very helpful. And we are here to give the solutions and the Lego blocks to assemble your castle in whatever format that you want to show up as in a brand aligned way.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the change is permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view, and profile leaders who are championing the move to preventive care. If you want to understand healthcare both as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, we give a shout out to LinusBio for their launch of Traced, the first of its kind test that uses a single strand of hair to provide a day-by-day view of exposure to elements in the environment. Then Jane Wang, CEO and co-founder of Optimity, shares why she's focused on elongating Healthspan and what her team's learned from engaging millions of users that most healthcare organizations still don't understand about motivating healthy behaviors. I'm Jared Johnson. Let's get it. Hey family, we're all about highlighting the innovations that are going on here in the rap community. So today we're giving a shout out to LinusBio. They're pioneering what's known as exposomic sequencing to transform how we understand, diagnose, and treat disease. And just last month, they launched a service called Traced. It's the first direct-to-consumer wellness test that provides a day-to-day view of exposure to elements in the environment with just a single strand of hair. We're talking nutrients like zinc and magnesium, as well as toxic elements like lead, arsenic, and cadmium. The interesting thing is that it reveals your exposure over a 30-day period. So think about how unique that can be. We always talk about how healthcare is episodic. It's taking snapshots at checkups that don't reveal the full story. Well, Traced was developed from research at Mount Sinai, and it offers a different approach than traditional blood or urine testing by showing how exposure changes over time. And it helps consumers connect those patterns to their daily routines, their travel, their home, and environments. So I want to give you a sneak preview. I took this test, and I review my results live on the air on an upcoming episode with LinusBio founder, Dr. Manisha Arora. So stay tuned for that. And in the meantime, if you'd like your product or service to be featured in an upcoming shout out, hit me up on LinkedIn. There's a lot of cool stuff happening in consumer health, and we love highlighting our favorites. All right, everyone, let's get into the flow. Please join me welcoming my guest today. I'm here with Jane Wang. Jane is the CEO and co-founder of Optimity. We're talking health, fitness, wellness, and a lot of things in the space of particularly healthcare leaders who kind of know this stuff, but might need help engaging with it and kind of putting it into practice in their own lives. A lot of that is where Optimity sits and kind of what Jane works on day to day, from what I understand. So first off, welcome to the show.
Thanks for having me. I'm glad to be here.
What else would you like our audience to know about yourself, about your background, and about Optimity?
Let me see. At the 10,000 foot level, maybe that's I'm a scientist. I'm a data nerd. I'm a mom of 2. I really enjoy the work that we do every day to elongate Healthspan and get people into the healthiest, optimal version of themselves. But we also like to have some fun at it, and a lot of it is really understanding human behavior and being empathetic towards our journeys while we're trying to be the best version of ourselves and learn.
So I will admit, I did not have the Optimity app until I was at the Nourishing Change conference a couple of weeks ago. So now I'm on it. Now I'm checking it every day. I've got little nudges coming my way. So I'll just put the plug in there. The app is really cool, easy to use, and I'm learning things from it as we go. So I might have some questions about that as we go a little further in. But help us understand a little bit too. I think it's helpful to understand where our guests are coming from in terms of just like your general philosophy about healthcare. And I think you pointed to a little bit there about elongating health span. Is that kind of where your work with Optimity comes from, or just like how in general do you think about healthcare and what kind of work you could be doing in this space?
Yeah, it's such a great question, which is what's our why, right? What's kind of driving the mission and why we're doing this? So, I began my career, I have a biochem and stats background. So, I began my career actually in pharma. So, clinical trials, phase two, phase three, really helping patients adopt new molecules and protocols that help elongate their lives, right? So we're kind of intervening at the place of where they actually need sick care. I worked in HIV. I worked in MS, Alzheimer's, which was really interesting work, and then ovarian cancer early detection. And I really loved the work that is around adherence, understanding why people take medication, don't take medication, understanding why people form habits, why a HIV patient won't take their medication, even though if they don't take it within 2 years, for sure they will get full blown AIDS and they'd be dead, right? Like, so why do people do that? And I really starting to understand the behavior reasons, the lifestyle reasons why these logical decisions actually doesn't exist truly in our healthcare system or in human behavior. So that's how my kind of first foundational layer of understanding came from, which is 10 years of doing that at a very nice, well-funded type of ecosystem. Fast forward, when I was working on ovarian cancer, I ended up unfortunately losing my mother to a different type of cancer. She was 52 at the time, and she had leukemia, and within 6 months, she passed away. It was acute myeloid leukemia, and um, I mean, it's been almost 16 years, but during that time, it was such a shock to my system because I'm like, here I am, late 20s, feeling good about like my life and losing my essentially my best friend and someone who I thought was going to be around until 100 years of life, right? So since all my grandparents were healthy, we had centenarians in our family. So I really thought we had good genetics and, we were health conscious and all the different stuff. And my mom looked healthy. She looks like I look today, right? And she's not much older than I am today. And here is something that I couldn't stop. I couldn't get her into. And at the time, my partner was a physician and he couldn't do anything about it either. And that just took me on a like loop. Um, and I really enjoyed that actually because it got me out into the Bay Area ecosystem. I got to work with some really amazing lead researchers on the early stage wearables. And, one of my colleagues, she formed the Stanford Wearable Labs, and we got to work on the first generation, like, I the Apple Watches, the Garmin devices, Jawbone, if you remember that, is no longer exists,
Yeah.
but Fitbits and so on. So really, really cool. And we thought, oh, amazing! Like what a crazy, amazing level of self-assessment that could be to connect preventative care, early detection to people that are just average kind of consumers like my mother. Like, how do you bring it from the clinical setting into people's backyards? So, long story short, I started my first company in doing that. It's really easy to do in the Bay Area ecosystem. And then I continue to do that today with Optimity, which is my second company. And right now we're at about 7.5 million members. So it's at a decent scale. And our goal is to be in every family in the US and Canada. So about 100 million lives to be benefiting from this. So yes, you're right. The app is accessible to everyone. We're very lucky to be working with, all kinds of associations like American Nurse Association just did their Nurse Week on this. We've done different campaigns with everything from, on diabetes, heart, and, professional associations and different things like that. And we find people where they're at. So be it blue collar workers or white or gray collar workers, all good. We really kind of look at things from the perspective, what are small activities you can do every day that are preventative and that are helpful and that gives you a good baseline, but can also help you learn about early detection and different things like that. And we have some really cool stuff coming down the road too in the next couple of years that I'm very excited about where the future of this whole space is going.
Amazing. Yeah, I was about to say, I think my first engagement with it was a step challenge at a conference.
Yeah.
So daily and actually having a conversation with a contact at the Optimity like counter actually got me to go on a run one night after the conference. And because I'm like, man, I want to place in the top 10 and the step challenge, and so I can say mission accomplished, that day. Right. For me, I was just gonna like go take it easy that evening and instead of like I actually got some fresh air and was real glad I did for what that's worth. But uh to me it was kind of a microcosm of the experience of the app of like what's possible. I'm like I clearly spent my time doing something I wasn't planning to, but uh, it felt better. I felt in better shape that day. And I came home from the conference, like not feeling what I usually feel, which is just like, oh, like I ate terribly. I didn't take care of myself. I didn't sleep well. That's how I usually feel after conferences coming home. I didn't feel that way this time. And I do feel like just having something there in my hand actually did play a part in that for what it was worth. And uh, I think it was interesting. I'm sure that's not the only type of experience here, especially when you start talking about things like early detection and other things that can connect in with what those daily experiences and daily activities actually like what they lead you towards. Because I think it can be easy from the user's perspective. At least I might be projecting, but but I think it can be easy from the user's perspective, saying like, okay, once I get in the habit of some slightly better, healthier choices for myself every day, what else, like what am I working towards, what's a goal, and kind of what's something that I can point to long term that I can see whether this is worth spending time on or not. So I guess that leads me to the question of like how do you engage all these millions of users, like, and what have you learned about like how to keep them in some kind of loop where they are checking in on an app at the very least. I know that that's a means to an end. Yeah, I guess just talk to me about engaging users and what you're learning from all.
Yeah, for sure. Okay. I think there's two questions in there that I can answer. The first one is uh, different people, right? There's people like yourself who is, male and that you're competitive, is you want to rank well, you want to do better every day. That's amazing. That's kind of our classic like Garmin user. That's our classic quantified selfer. Great. You guys are amazing. We gamify things. We make it achievement oriented because for you, it's really about dopamine cycles and about having that kind of, pizzazz or things that you can earn within a short period of time. So we love people like that. And they tend to dominate our leaderboards and they tend to be leaders within our movements and so on. Movements is like kind of how we classify these personas. Um, the second group, which is actually by far the largest group, are more moms like myself. So this group is less competitive. I'm still competitive, but like a little bit more collaborative. Like I'm totally happy going on a walk with someone, even if like I participated. It's great. I enjoy that experience. I don't have to be top one, or two or top 10. Like it's not really that important to me. But we are a huge part of the population. We are the CEOs of our family. We make grocery decisions. We make, healthcare decisions. So it's really, really important. So we have this is probably pretty unique to Optimity because many of the fitness industry is built by really amazing entrepreneurs, but they tend to be male because they want to win in that, right? Like they're winners in the industry. There's less women entrepreneurs or mom entrepreneurs. It's just like historically, maybe 50 years ago, probably didn't exist at all, like a fraction of, but now maybe hopefully we are about 1 to 2% of the population. But honestly, on the platform, it's about 60% of the user persona. It's women. They tend to be moms, or they're caregivers for their elderly parents, and they're busy. But they want to be part of a community. So we have different buckets. So like physical health, nutrition, mental health, social connectedness, and I'll come back to that. That's really important, and financial health. So women's kind of like the fabric of this. And for this persona, it's the social connectedness is really important, helping them find belonging, a social group, a tribe, whatever you want to call it. We have different words for it. It could be, work teams, or it could be other groups for conferences. You haven't seen it at the past one that we were at for Nourishing Change, but we do this for some other events where we do conference matchmaking, and it's curated groups, walking groups with people that are looking to meet each other. You want to network, and this is such a nice way we call it net walking. So it's kind of networking, but you're walking along and you have this experience, and it's great. You get the steps that you need to be just healthy, which is around 7,000. And usually Americans are under 5,000 average. So why not do that while accomplishing some professional goals as well and social goals as well? So that's kind of the second bucket of what we do. And then we have some small buckets, everything from aging population to longevity to people that are seeking even like kind of coachable type of behavior. So people that maybe have a condition that would like to not necessarily be drug managed in that condition, and that want lifestyle coaching. So that's a really nice kind of learner and coachable personality as well. So different strokes for different folks is kind of the first answer to your question. I think the second part of your question was really about loops, behavior science loops. And that's a codified science at my company. We bring the loops in. So on our app, of course, we use it. It's a test ground. It's everything, we experiment with it. We put the latest and the greatest on it. But we're also white labeled and embedded into other people's apps. It could be insurance apps. It could be, there's a insurance company called Green Shield, where inside the Green Shield Plus, they use our content, they use different aspects of it. So in it, we have this trifecta that creates this loop. So the trifecta goes, health journey, right? So a person, for example, they want to lose weight. That's a particular type of journey. Or if the person wants to manage a condition, that's a particular type of journey. Or the person wants to win their run, they're training for a 5K. Awesome. So these are journeys. Okay. So that's one. So content to help coach person on that journey. That's one. The second is for every little thing that they're achieving here, there's a rewards center for that. There's intrinsic rewards, there's extrinsic rewards, there's social rewards. We just talked about different buckets, different things. People's brains light up in different ways. So we also have a rewards API and a rewards basically control center for that. And that helps the person basically like repeat the habit of what we want them to do in the core loop. Okay. And then the third part is really about pushing them. So they have their core journey, but there's also the challenges journey. So you talked about that a little bit too. You joined a challenge. It's like not your core loop. Like maybe you're on a special core loop that you're on. You're like, hey, I want to, these are my daily routines. It's great that I get rewarded for that. But we want you to like where you grow as a person, where you achieve health benefits is when you push yourself. That's why in training you have progressive overload, or in lifestyle you want to do these things, you want to be better. So the challenge, we have a challenge as a service component of it, which kind of pushes people beyond their normal loop that they're in. And then that helps the person grow and become hopefully a better version of themselves, but at least explore something that they perhaps have not done. Like a lot of people, maybe they don't do anything for their mental health. They should. Or maybe they have never explored food as medicine and they just work out a lot. Interesting. Or they just watch what they eat, but they never work out. Like, cool. Let's just expand the person to be more holistic.
There's a lot there. You mentioned, I do want to come back to the social connectedness and financial health, which are two other pieces that you mentioned here. How do those come into play? Or I guess, like, what are some of the common ways that those play into those loops you just described? Like, are there health journeys there that are more common? Or I'm just curious how those two pieces fit into some of the other areas.
Yeah. So, originally, when we did the loop, the social connectedness was part of the loop itself is actually a flywheel. So it's a few loops together. We have a core loop, we have an inner loop and an outer loop. it'll make more sense. Like, I think we have like an Optimity University thing. Like, I'm happy to share some of it on like Substack or wherever for people that are useful to find it useful. But social connectedness used to be an outer loop. So what we mean by that is that you share it out to someone. I have achieved something. They can join me. They can see how great I did in that. It's kind of about that. But then what we noticed for women is that no, it's actually part of their core loop. Like, like they don't even need it to, like, like I don't need to celebrate that this is my 300th time at F45. It's great. Like, it's, I don't need that much attention, but I just enjoy seeing my friend there every 2 days in the week. Like, that's amazing. That makes me happy, So we've kind of jigged it around a little bit based on the persona, but we find that the social connectedness is actually really important for population health. And from a stats background, in blue zones, you always find these multi-generational families or communities. There's Japan, there's this like group of people that come together that become your little tribe. And that's really interesting because when you uh, don't have that. And America's quite lonely, actually. It's very interesting. People don't really like have the same stable friends or friendships or these connections that give them uh meaning or common activities or things like that. And when you do, those people tend to be quite happy. So they have good, healthy nervous systems. Some of the activities are physically active. You go out, play tennis with someone, play pickleball, go golfing with people, like whatever you want to do. Great. And then it also helps people knowledge share. So you're not just consuming maybe social media that it's like not really there and empathetic towards you. You're not really, self-dwelling on different things like that. This helps you kind of see other perspectives from a very warm and happy and hopefully fun place.
Great examples too of just how all this comes into play. Tell me more about the white labeling part in terms of like what you offer and like how that helps stakeholders who are using the Optimity. Is it the data itself, or is it like the program around it that's built into apps or programs that they're using?
Yeah, we call it solutions. So they're there to solve an engagement problem usually. So what it looks like for employers is, hey, like we want people to do our corporate wellness program, but the same 10-15% of healthy people always participate. Like how do we get everyone involved? How do we get this into like a 50% of our people participate type of thing? So we help them do that, and that doesn't necessarily need a white label solution. So we oftentimes are just like, it's the Optimity corporate wellness program that we sell directly. Um, the white label happens within insurance companies, and we actually started working with life insurance companies first because life insurance companies, they're actually betting on the long term. They're betting on your longevity. They're betting on you becoming a centenarian. So it actually makes sense. But unfortunately, these companies are not in the habit of engaging. Like they sell them your policy and then you pay your policy every year. But like maybe if you're lucky, you get a birthday card from your broker. But like, like on the weekly, daily value, I'm pretty sure you don't even remember who your life insurance policy issuer is, So we work with them because we really believe in the win-win, like business fundamentals of why they do it. But we have to put together a program that fits inside of their, you know, brand promise, their own, the actual math of the actuarial structure. So they're like cost effective, but at the same time is engaging in the right frequency with their policyholders. So there's a whole science to that, and that's very specific. And then that, of course, translates both the employer, there's health plans that need to do that as well. But it's different type of frequency again, and different layer of, I would say stakeholders and programs. And I think we really focus on initial activation. So getting people to participate and then also keeping them on this journey for as long as they can with layers of social connectedness, rewards, gamification, and, like this nudging component to it. Lastly, I'm excited about kind of this, food is medicine, movement is medicine, both different movements, I would say. Um, the food is medicine is interesting because everyone has to eat. Right now there are 1 in 8, closer now to 1 in 7 people are on a GLP-1 in the US. There's going to be a lot of opportunity to shift behavior, and there is changes in how people basket is. I think if you engage in the right way, there's definitely places where gamification, nudging, and this type of health journey can also be very helpful. And we are here to give the solutions and the Lego blocks to assemble your castle in whatever format that you want to show up as, in a brand aligned way, in a business aligned way. And then movement as medicine, gyms too. Like right now, gyms are still only used, the memberships are only, again, 10-15% of people that are health conscious. But why, right? Like, why? That doesn't really make a lot of sense. And I think that's part of the work that we can do to create this connection between, maybe, I mean, in my ideal world, it's not happened today, but let's say we're having this conversation again 3 years from now. It would be my dream to connect a grocer with a gym network, with an insurance company, right? Like, and then having this really cool, like, trifecta of total health. This is a promise overall. So it's like physical health, nutrition, financial health. That's how you make a healthy centenarian. This is how you create like true blue zones anywhere.
Okay, you're really opening up this thought to me because what's limited that from happening in the past, not only connecting any type of data that enough of it that's meaningful to give a well-rounded picture of like all the things that are impacting you and do include things like food and movement and fitness and not just medical conditions or medical records. All the data that we know is needed to give that well-rounded picture of someone's health. It's so fragmented. I mean, on the healthcare side, we've spent years talking about how fragmented the data and thus the experience becomes. And there's still kind of a dichotomy of like, okay, hey, once you need treatment, let's talk to your provider, or even an app, but like, let's talk about treatment versus let's talk about prevention totally differently. I still see these treatment and prevention conversations happening like not in a connected way. They are just still happening in different sides. And the more we can connect a lot of these dots, especially on the preventive side, yeah, my vision would be similar in that we're not thinking about it of like, this is something I'm doing to prevent myself from getting sick, or this is something I do once I'm not feeling well. Like that, it's literally just all me optimizing my health on a day-to-day basis. And hey, I want to feel better. I want to feel a certain way. I want to be able to have, you know, autonomy. I want to be able to, I don't know, be with my family. I want to
Yeah.
be able and capable, and that does include my mental health, my financial health, my social connectedness, and I don't know. That's really opening up a vision to me of like what's not only what's possible, but like the direction to go and what it would take to get us there. Because there are a lot of stakeholders involved. To your point, there's your health systems. There's probably employers, there are insurers, there's health plans, and then there's a lot of other entities involved in that as well. But that's the direction for us to go. I guess is kind of what I'm taking away from that is like let's move that way. Like let's keep doing that, and let's see the value of where that can get us on an individual basis of how we can live healthier lives.
Yeah. Yeah. Amen.
What Jane, what's your advice to fellow founders in this space? You pointed to a couple of lessons, or insights early on in the journey for yourself. What else do you share when founders come to you and ask for, how to do this?
I have two very practical sets of advice that I can give to someone that I don't talk to. So usually when I talk to founders or my friends, I ask them more about, it's almost like a discovery, like you try to understand what's their context and so on. I try not to like push my advice on them. But I think generally two good guiding principles is, one, you're doing something super hard, please take care of yourself first. Air mask on first. So whatever you do, maybe you're already mid-journey, maybe you've already like sacrificed your own maybe physical health, financial health, social connectedness. I'm sure in all three fronts you've done that. I'll be your friend, connect with me. Like we have an amazing founder program. Like it's great. And I think that's really important. Startups, company running, scale ups, whatever you're doing, these are marathons. So you need to be able to fuel yourself from this holistic sense to be able to win in that. So that's probably one like super practical like thing that everyone could benefit from. And then I would say the second one is really about be clear about whose problem, what problem you're solving. I find many times when I talk to founders, there is lack of clarity in the problem because just as especially in healthcare, right? Like healthcare is so it's a soup of different types of issues, and none of the incentives are aligned. Like it's really complicated. So I think the way to really win in healthcare is the riches are in the niches. Really understand your own home market. Really understand your true first problem. Are you solving a user problem? Are you solving a business problem? Who it is it's solving for and what that looks like. Over time, I fumble through a lot of different things, different experiments. You're supposed to. That's part of the game. But things will become clear. I think Steve Jobs had a really great quote about that because he took calligraphy class. It was like all these different things. But then he really focused in on something and he did it really beautifully. That's great. But it'll all come together. But if you want to save yourself some time, stress, and be able to deliver value, do one thing for one group of people really well.
Fantastic. Great way for us to wrap there. Jane, thanks so much for giving me a few minutes today, for opening up this world to us. And best of luck with everything you have going on.
Yeah, absolutely.